So let's kind of define what fat grafting is versus what fat repositioning is. Fat repositioning is something that I do quite a bit of when it comes to lower lid blepharoplasties, where I use the patient's own native eyelid fat, the fat that's prominent in the lower eyelids, and then repositioning that, essentially moving it down to a place to improve the hollowing in the under eye area. So that's what a blepharoplasty or fat repositioning is. Fat grafting is where fat is taken from another part of the body, such as near the belly button or the flanks or the sides of the legs, and that fat is gently harvested, prepared, and carefully injected, similar to how I inject under eye fillers in the office, but it's done in the operating room. There's pluses and minuses for both techniques. I prefer fat repositioning when I can for patients that have excess fat in their lower eyelids. I will consider fat grafting in those scenarios of patients that have significant volume loss around the eyelid area, for instance, the mid-face area, the cheek area, that I can develop a base of some volume with fat grafting, but often I will then touch up these patients in the office several months later with some fillers because some of that fat is a little unpredictable, and that's where the challenges are with fat grafting.